So tell me, what makes a professor in a medical school write a book, Lies I Taught in Medical School? How did you come to that?
Yeah, that's a great question, because before I wrote the book, I essentially spent my entire career as a mainstream participant in the medical establishment. I was a medical school professor and still am at large medical schools here in California. And I, practiced medicine. I wrote papers, hundreds of peer-reviewed papers. I got millions of dollars of grants for my lab from drug companies, from the U.S. government, from equipment makers. So I was, and I still am part of the system. But to your point, what forced me to change is what a lot of people face was that I was suddenly diagnosed with 4 diseases that were a complete surprise to me. And when that happened, it forced me, largely out of self-interest, really self-preservation, to begin questioning some of the beliefs that I had and that many of my colleagues still have about the way these diseases work. Big challenges are a different type of diseases that are chronic diseases, things like obesity, diabetes, hypertension, cancer, heart attack, stroke, Alzheimer's disease. And these diseases, unfortunately, don't respond to a pill or to surgery or a blood transfusion. In fact, that's the challenging part. So I trust the healthcare system. And when I was diagnosed with these diseases, the first thing I did was I went to my doctors and I said, I've got these diseases. What shall I do? And they prescribed medicines for me. And they said, lifestyle may sort of work, but really you need to understand you're going to be on these medicines for the rest of your life. So get used to it. And so I did follow the medical advice, but I realized, it wasn't going to end well knowing what I know about those diseases. And I began to question things and try different approaches.
Yeah. So do you want to tell us these diseases that you were diagnosed with?
Sure. And first of all was a type of arthritis or joint disease called gout. Second was hypertension. Half of most adults have hypertension. It's a very common disease now. Pre-diabetes, which, almost half of people are either diabetic or pre-diabetic. And then finally, dyslipidemia, abnormal blood lipids. And so these are diseases that are very common that many people face. And the interesting thing is they were approached very differently. I went to sort of a different specialist for each one, or they said, hey, your arthritis is not linked to your hypertension. Those are different diseases. Get over it. And what I came to understand is that, which was very surprising to me, is that they are actually all linked and they all have a common root cause. And furthermore, the medicines I was being given, which were standard treatments, although they took care of the symptoms, they didn't actually change the underlying progression of the disease. So the disease was going to go on, and it might not bother me as much because the symptoms wouldn't be there, but the disease would progress. And that was very concerning because I wanted to fix the disease. So I began looking at alternatives that would address these root causes. And that was the wake up call for me. And, the book's about my process and how I did it. And I wanted to share my experience with everyone else because I was ultimately able to reverse these 4 diseases, get off all medications. And, I think that knowledge isn't out there. People are still going to their doctors and being put on these medicines, which I'm not saying you shouldn't follow your doctor's advice. If you're put on a medicine, you should definitely take it. But what I'm saying is, as you look at options, there are other things you may want to consider other than just a lifetime of prescription medicines.
Yeah.
Nutrition actually isn't taught much in medical school, sadly. Even to this day, there's only minimum emphasis on nutrition. Instead, nutrition has been taken over, or has been is run by the nutrition scientists, basically by dietitians. And full confession, my mom was a dietitian, so I know what that's like. But in the book we talk about how scientific organizations and what we think are reputable scientific organizations like American Heart Association, American Diabetic Association, they like the doctors are corrupted by pernicious influences that does that. And so the diet organization, American Dietetic Association, was founded by someone with a sort of strong religious belief and a religious nutritional agenda. I mean, nothing against religion, but it shouldn't be driving our scientific choices. So there's the American Dietetic Association, the diet organization, the dietitians have a certain perspective on foods, to the point now that you go to their meetings and they're sponsored by Coca-Cola and McDonald's, and they're full of junk foods. And just like many of our other medical science societies are corrupted by big food influences and big pharma influences, and they can drive the agenda of these, unfortunately.
I am so sorry. A growing number of physicians have made open apologies for their past recommendations to their patients, where they encouraged low-fat, high-carbohydrate meals as a healthy lifestyle choice. I want to also add my sincere apologies to all my patients for the wrong advice that I have given over the years when I recommended a low-fat diet.
I am privileged to have gone from an approach where I was trained to really diagnose medical conditions as best I could. And if I got that diagnosis right, I was considered a phenomenal doctor. But then later, I realized that nobody was really healing. Most of my patients were being managed quite well with medications. And I never even thought to question, was that optimal, until I realized that there was another way. And I later learned that lifestyle was the key. And when you take that approach, then people can actually get off medicine. They literally can get off medicines in many cases. And it was kind of a aha moment. And from that moment, and that was probably about 11, 12 years ago, when I really started to focus on low carb, I shifted my medical practice from focusing on optimizing medicines and looking at people, instead, not looking at people with a side eye when they are not taking their medicines, to a model where we literally are trying to figure out, when do we start to wean you off medicine? So I became a deprescriber. And I literally had to train myself how to do that safely. For example, the guidelines for therapeutic carb restriction, which were created by Adele Height, and you can find those on Low Carb USA's website or the Society of Metabolic Health Practitioners website. They teach us how to safely take people off medicine. So it's really nice to go from one model where it was managing to a new model where we actually now get people off medicines and help them heal. So it's changed how I practice medicine. It's changed how my patients perceive me. And we celebrate almost every, day victories of people who are doing better. Their kidneys are better. Their blood pressure is better. Their need to take a statin is better. We fix all of those things. And it's been a great gift, man. So that's why I try to teach this widely, so that more people can learn that there's another way. And the best way to heal is to use lifestyle as the key.
Yeah. But how did you come to that yourself? Like, you were vegetarian, vegan yourself, and now you've gone low carb. So what was the deciding factor there? What was the switch?
I think there were two issues. One was the research I did. When I was preparing to write a book, Fix Your Diet, Fix Your Diabetes, I needed to do research so I could have, references, right? And so the research was one issue, and then the other was just my personal experience. So I went into a vegetarian lifestyle, and I had been vegetarian for 8 years because I wanted to be healthy, and you just kept hearing the messages out there in the world that was the best way to do it. So, and it was also my kids. I had I was a new parent, and I wanted to make sure that they understood. So what I did was for my babies, it was really for me to understand. I got a book called How to Disease Proof Your Kids by I think it was by Dr. Furman. But anyway, the book was plant-based, and I just went down that rabbit hole to help my kids. But I also made lifestyle changes back then because I wanted my wife to be healthy also. So when I went down that plant rabbit hole, and I followed the advice of experts like Dr. Colin Campbell, you may know him from the China study, Michael McGregor, Dr. McDougall, and others. They just convinced me that was the best approach, which was plant-based. But then I later learned that these experts primarily relied on observational research, right? And at the time, when I started, I didn't really understand that observational research only shows possible correlation, possible causation. And I didn't understand fully that randomized controlled trials was the way to go. So once I started looking at randomized controlled trials, which show, A equals B, it shows causation, that's when I found that the vegetarian diet was inferior to the low carb diet. In fact, it was really the Public Health Collaborative and other organizations that really, in plain English, show that if you compare a low fat diet to a low carb diet, particularly for weight loss in this particular example, for significantly greater weight loss, it was basically, I think, around 39 studies that were low carb, which were superior to all the other low fat studies that were done. It was 39-0. So there was no comparison. There was 0 low fat studies that were better than low carb. So the first issue for me was the research did not justify me writing a book about diabetes based on low fat anymore. I couldn't do it. So I shifted completely. And what I did is I did an experiment on my kids and my wife first. And the experiment was, it was really for them and to experiment. So we did the experiment, and the experiment showed that for all of us, we felt better. My wife was able to manage her blood sugars better. But more importantly for me, I had a history of irritable bowel. And it wasn't until I did a low carb diet that my symptoms went away, and the belly pain that I was experiencing went away. The bloating that I was experiencing went away. Oh my God, the gas that I was experiencing eating all of that high fiber food went away. And of course, with irritable bowel, you can get diarrhea, and it all went away. And so, but I think if I think about all the things that got better when I went low carb and got confidence in that, I got to a point where I didn't think about, where's the bathroom? When you have irritable bowel, you're just always, where's the bathroom when you're out? And that was the number one thing that was nice. So my mental health got better because for the first time in my life, I felt normal. And honestly, I think people out there who are checking this out, if you have irritable bowel as an example, and you don't know what normal feels like, I guarantee you normal is not how you're living right now. So once you get to normal, you never want to go back to not feeling normal. And I would say that's true for most health conditions. It's normal for me to have an up and down sugar. No, it's not. It's normal for me to have a high blood pressure. No, it's not. So we want to get back to normal, and normal is not living with these so-called chronic medical conditions. So for me, my wife, and my kids, man, it's been, you can't go back to not living and feeling normal. So I'm just so grateful that, like you and others, that we found a way, and it was this lifestyle where we reduced the poison, which in my opinion is excessive carbs. So it's been great.
So when you you found all this research, and you've been a doctor for so long, you've been through medical school, you're in practice, and why didn't you know this beforehand?
Honestly, I think that we were taught to normalize the abnormal, going back to that concept. So I thought I was a really good doctor when I was able to manage my patient's disease as well, because we were taught that that's what you do. We were taught that all of these medical conditions are chronic. You really can't reverse them. I mean, literally, that's being stated not just for diabetes and hypertension, it's being stated for obesity. Well, you got to manage it. And I think that concept is what sticks to me the most, is that I didn't know that a person with diabetes can get off medicines. I never knew that, because in the 18 years or so before I actually adopted these changes, nobody was really getting off medicines, maybe a couple of people, and they were like ultra athletes and things like that. So I just think in the medical conventional training model, we're not really given the understanding that, yes, you can reverse these so-called chronic medical conditions. And I think that, so when you're living in that bubble, you're being judged by, is that patient on the right medicines? Are you optimizing their treatment? So if a person comes to me and they have, let's just say they have diabetes, but they're at risk for heart disease, obviously, with diabetes, we're going to put them on a medicine like Jardiance, which will then tell the body to urinate out the glucose or the sugar. We should be telling them not to consume those things, but instead we give them a medicine like Jardiance. We tell people that your cholesterol is high, and that'll increase your risk for cardiovascular disease. We now know the total cholesterol and the LDL cholesterol are horrible predictors of cardiovascular disease, but we're taught that we need to put you on a statin to lower those numbers and reduce the inflammation. Oh, by the way, if you do lifestyle, you reduce the inflammation and have a greater impact on reducing the metabolic markers that we look at beyond the cholesterol and LDL. So it's all about the training. We're taught to make sure people are taking the right medicine. We're not trained to teach them that lifestyle matters. And for me, after I did my own research, and it's actually a sad statement that I had to do this on my own. It's a sad statement that we're unicorns in this world, because people look at us like, oh my God, what are you doing with these keto and carnivore diets? But these are the diets that are healing people. And it was really just me recognizing that, and the medical community has not fully understood the impact. And I think if my clinical colleagues understood the impact this would have, and that you can solve many problems by simply telling people how to eat, and you just have to support them when they're making these changes. You have to give them coaching. You have to give them group support. You have to give them the diet that works, so that you won't demonize them because they're not doing well. So I think we're being taught to focus in an area that gives us very low results. And if you want return on investment, you'll find that the dietary pattern will solve many of these problems. So it's really part of why I'm out here on a podcast, or the outreach committee I chair for the Society of Metabolic Health Practitioners, and we now have a American Diabetes Society that Dr. Kim Berry is putting together. The goal is to, teach people that this is possible, because the current health system does not teach us that nutrition is the best medicine.